All right, let's dig into something that maybe doesn't come up every day, but it really shapes the movement, the very survival of some pretty amazing animals.
Yeah, absolutely.
We're talking foot health, for camels, llamas, alpacas, deer.
hmm
What actually happens when their claws or their hooves have problems? It can be a hidden crisis, really,
It's a fascinating area because when you actually compare them, their feet are so different.
right?
And those differences, well, they really shape what makes them vulnerable, what challenges they face, whether they're in, say, managed care or out in the wild.
Okay, so that's what we're doing today, this deep dive. Our mission is to kind of give you a shortcut.
Yeah, pull out the key takeaways.
Exactly. From research reports, academic work on claw and hoof defects and camelids and cervids. Why are these things critical? How do they differ? And, what might surprise us about animal welfare and just plain survival?
Should be interesting.
So first things first, why do feet matter so much? It seems basic, but...
Well, it is basic, but it's fundamental.
Mm.
For any ungulate, whether domestic or wild, foot health underpins everything. Their well-being, how they move.
And survival.
Absolutely, their survival. Think about it. For production animals, foot problems mean economic losses. Straight up. They can't produce well if they can't move.
Right. Pain, reduced mobility.
Exactly. But for wild animals, it's even more stark, isn't it?
Yeah, it directly hits their ability to, find food.
Find food, escape predators, even reproduce.
Yeah.
Healthy feet are non-negotiable.
Okay, so that sets the stage.
Yeah.
Now, you mentioned anatomical differences. Let's get into that. Camels first. Llamas, alpacas.
Right. So camelids are interesting because they don't technically have true hooves like, say, a cow or a deer. They're in a group called Tylopoda.
Tylopoda means padded foot.
Exactly. Their foot is built differently. It's designed to minimize impact, so they bear weight on the second and third phalanges, the toe bones.
Okay.
And they have this broad, kind of leathery two-part pad underneath. It's got this deep, fatty cushion.
Built-in shock absorption.
Pretty much. Now, the large toenail or claw you see at the front, it's actually not weight-bearing.
Oh, really? So what's it for?
Traction and propulsion. Think of it like a grappling hook almost for grip.
Okay, padded foot for camelids.
Yeah.
Got it. Now contrast that with cervids deer, elk.
Very different setup. They are true ungulates. They have classic cloven hooves.
Cloven meaning split.
Yeah, two large weight-bearing hooves per foot. Those are essentially the super hardened toenails of their third and fourth digits.
And they have those little ones higher up too, right? Dew claws?
Dew claws.
Hmm.
Usually smaller, higher up, don't typically touch the ground. The main hoof itself is like this hard, keratinous capsule.
Like a shell.
Kind of. It's got the hoof wall, the sole underneath, and an internal pad protecting all the sensitive stuff inside. Bones, tissues.
So fundamentally different designs. Padded cushion versus hard capsule.
Right, and that difference leads to different problems.
Yeah. Okay, let's talk problems then. Starting back with camelids, especially the ones, living domestically here in North America. What's the biggest foot issue they face?
It's almost surprisingly simple. It's toenail overgrowth.
Just overgrown nails.
Yeah. See, in their native habitats, think Andes mountains, rugged terrain, they're moving constantly.
So the ground wears the nails down naturally.
Precisely. But put them in a domestic setting, soft pastures, maybe less space to roam, less activity.
The growth outpaces the wear.
Exactly. And when those nails get too long, they start to curve. Inwards, outwards, sideways. It forces the joints in their toes, the interphalangeal joints, to rotate abnormally.
Ouch. And that messes up how they stand and walk.
Totally. It changes their whole conformation, their gait. It causes chronic joint rotation, which leads to pain.
Like arthritis.
Essentially, yeah. Degenerative joint disease. It puts all this unnatural wear and tear on the bones and joints, and it really interferes with their natural pacing gait. It's got to be uncomfortable.
I bet. So managing this, preventing it, what's the key?
Regular trimming. It's crucial.
Okay. Is it tricky?
It requires care. The goal is to trim the nail so it's level with the bottom of the soft foot pad. You generally use sharp pruning-style shears.
Like garden shears?
Kind of, yeah. But specifically for hooves or nails. And you make small cuts, being really careful to avoid the quick...
The sensitive part inside, with blood vessels.
Exactly. That pink living tissue. You nick that, it bleeds, it hurts. So small cuts. Sometimes soaking the feet first helps soften the nail.
Makes it easier to cut.
Right. And if the overgrowth is really bad, you can't just chop it all off at once.
Why not?
Because the quick grows out with the nail. You have to trim incrementally, maybe over several weeks, to give that quick time to recede safely.
Okay, patience is key for severe cases. Now, are there other foot issues besides just overgrowth in camelids? Infections, maybe?
Oh, definitely. They can get things like interdigital dermatitis.
Inflammation between the toes.
Yeah, or pododermatitis, which is inflammation of the foot pad itself. And then you have things like foot rot or abscesses. Those often pop up in wet, muddy, unhygienic conditions.
Makes sense. So what causes all these issues? Is it just bad luck?
It's usually a mix of factors. There can be a genetic predisposition, sure, but environment plays a huge role. Wet, muddy ground, or even constantly being on rocky surfaces can cause issues.
Nutrition, too.
Absolutely. Deficiencies in things like zinc, biotin, copper, those are vital for strong hoof and nail structure.
And obviously, like we said, not trimming nails properly.
That's a big one for overgrowth. But even systemic things like obesity or insulin resistance can make them prone to problems like laminitis.
Laminitis. Inflammation inside the foot.
Yeah, inflammation of those sensitive laminae. We see it more often discussed in horses and cervids, but camelids can get it too.
So for domesticated camelids, it sounds like the biggest headache is often something we kind of cause or fail to prevent by changing their environment. Overgrown nails being the prime example.
It's a major factor, yes. How we manage them directly impacts this common debilitating problem.
Okay, so that's the camelid picture. Let's shift gears to cervids, deer, elk, moose, especially wild ones. Is it a totally different story?
It really is, often far more complex and, frankly, more severe in the wild. One major issue, particularly for elk in the western U.S., is something called treponeme-associated hoof disease, TAHD.
Elk hoof disease, I think I've heard it called that.
That's the one. And what's really striking here is the cause. It's a polymicrobial infection, multiple bacteria involved, but these spiral-shaped bacteria called treponema are consistently found in the lesions.
And how does it spread?
The thinking is through contaminated soil, especially moist soil, which makes it incredibly hard to control in a wild environment.
Wow. And what does THD actually do to the elk's hooves?
It's devastating. It causes these awful lesions, usually right where the hoof meets the skin. They penetrate deep into the hoof horn.
Leading to
Hooves that get deformed, overgrown, cracked, broken. Sometimes the entire hoof capsule just sloughs off.
Oh, that sounds incredibly painful.
It is excruciatingly painful. It causes severe lameness. The elk basically can't walk properly. They can't forage effectively, can't escape predators.
So it often leads to starvation or predation.
Yes, frequently. Starvation and death are common outcomes.
Is there anything that can be done to treat it in the wild?
Unfortunately, no. There's currently no practical treatment for THD in free-ranging elk.
So management is just watching it spread, trying to contain it.
Pretty much. It focuses on surveillance, tracking where it is, how bad it is, and trying to prevent humans from accidentally spreading contaminated soil, maybe on boots or vehicles.
That's grim. Okay, another big one for cervids you hear about is laminitis or founder. You mentioned it briefly with camelids. How does it play out in deer and elk?
It's a significant issue, often linked to nutrition in cervids, specifically sudden dietary changes.
Like what?
Typically, getting access to a diet really high in fermentable carbohydrates, think corn, grain, maybe from supplemental feeding or bait piles, and low in fiber.
So like binging on junk food, basically.
In a way, yeah. It messes up their digestive system, can lead to acidosis, systemic inflammation, and then inflammation within the hoof. Those sensitive laminae get inflamed.
The glue holding the hoof together.
Exactly. That Velcro analogy is pretty good. When that gets inflamed, it's incredibly painful. Mineral deficiencies, too, especially copper and selenium, seem to play a role sometimes.
And this leads to that weird-looking slipper foot.
It can, yes. Because the laminitis is painful, the animal moves less.
So the hoof doesn't wear down.
Right. It keeps growing, often excessively, and can curl upwards. That's the characteristic slipper foot, or sometimes called sleigh hoof shape, you see, particularly reported in moose, but other cervids too.
Is the slipper foot itself painful or just the underlying laminitis?
The initial laminitis is definitely painful. The deformed hoof itself might become less acutely painful over time, but it makes the animal incredibly clumsy, slow.
Which makes them easy targets.
Hugely increases their vulnerability to predators, yes.
How do you manage laminitis? In farm deer, maybe?
In farm settings, it's all about careful dietary management. avoiding those sudden high-carb overloads, ensuring balanced nutrition.
And in the wild.
Well, it really highlights the potential downsides of things like supplemental feeding or baiting, especially if it's done improperly or during times when natural food is scarce. It can unintentionally trigger these health crises.
Interesting point. Are there other common hoof problems in cervids besides THD and laminitis?
Sure. They can also just get general overgrowth, like the camelids, cracks and fissures in the hoof wall, white line disease, which is a separation within the hoof layers.
Hoof rot.
Yep. Bacterial infections, often from standing in wet, dirty conditions. And occasionally, though rarely, you see congenital defects, sometimes linked to coat color patterns like piebaldism.
So quite a range of issues for cervids, too.
See, definitely.
Okay, let's try and pull this together. Comparing the two groups, what are the main takeaways?
Well, I think the biggest contrast is this. For your domesticated camelids, the most common, really debilitating issue is often that toenail overgrowth.
Which is largely preventable with routine care.
Exactly. It's manageable through good husbandry. It really highlights how their environment, the one we create, shapes their biggest foot challenge.
Right, whereas for cervids, especially wild ones,
It's often much more complex, much more serious. You've got infectious diseases like TAHD, where treatment is basically impossible in the wild,
and these dietary-induced problems like laminitis leading to slipper foot.
which drastically reduce their survival chances. The challenges are just different in scale and type and often harder to address directly in wild populations.
But the way vets diagnose problems, that's similar, right? Looking at the animal, x-rays.
Oh yeah, the diagnostic approaches share common ground. Clinical exam, just watching them walk, looking closely at the foot. Radiography or x-rays are often used. Sometimes therapeutic trimming or exploring the hoof can help diagnose too.
And treatment principles, if treatment is possible.
Also share similarities. Corrective trimming is key for overgrowth or deformities. Antibiotics if there's infection. Pain management is crucial.
Managing the environment, keeping things clean and dry.
Vital. And nutritional support, ensuring they get those key minerals and a balanced diet.
So underlying all of this, for both groups, prevention seems absolutely massive.
It's the cornerstone. Regular hoof care where possible, especially for camelids. Controlling the environment, clean, dry, well-drained areas. The right kind of ground surface.
And that balanced nutrition we keep coming back to. Biotin, zinc, copper,
Essential building blocks for healthy feet.
and the outlook. If an animal does develop a problem,
Generally, it's good for mild to moderate issues if you catch them early and intervene.
but for severe cases, chronic problems,
Yeah.
especially in the wild.
And then the prognosis is often much more guarded. Sometimes, unfortunately, it's grim.
So wrapping this up, this deep dive into something as, well, seemingly basic as feet.
Uh-huh.
It really tells us a lot, doesn't it? About animal anatomy, about their specific health challenges, and this really delicate dance between, the natural world and how we interact with it or manage them.
It absolutely does. It reveals these profound insights just by looking down at where they meet the ground.
Which leads to a final thought, maybe something for you, the listener, to mull over.
Yeah, considering these really unique vulnerabilities, the padded foot versus the cloven hoof and the different environments, wild versus managed, what does this all mean for how we approach conservation?
Or how we practice responsible animal husbandry, especially now, as human activity pushes more and more into wildlife habitats.
It's a big question. How does understanding their feet inform how we care for them or how we try to protect them in a changing world? Something to think about.